the interprofessional case study.
Yeah.
Our patient is Carla B. That is patient number 3. Carla is an 8-year-old who has some disabilities that we want to handle and care for. This group is Kate, Karina, Nazma, Freddie, and Alec.
It's not all right.
So Carla B is an 8-year-old female. She was born prematurely and diagnosed with spastic quadriplegic cerebral palsy at 6 months old. Cerebral palsy is a neurodevelopmental disorder caused by lesions in the brain. This disorder has caused Carla to face many challenges. Carla's disorder is affecting her arms and legs, swallowing, speech, cognitive development, and occasionally causes seizures. She is prone to pneumonia, otherwise her health is generally good.
So healthcare professionals, a number of healthcare professionals will need to work interprofessionally and collaboratively in order to treat and care for Carla. Such professionals include a primary care physician, physical therapist, dietitian, speech therapist, and registered nurse. She will also be seeing an occupational therapist and physician assistant to further assist her needs. SMART Goal 1, Swallowing and Growth Development. Carla will significantly improve her swallowing and growth development through nutrition, motor control, and speech therapy within 6 months. She will be going to therapies and appointments as assigned and constantly evaluating her health and progress. She will also be following a more nutrient-dense diet as directed by the dietitian. With consistent therapy and following the meal plans and coaching from the dietitian, Carla can most certainly show positive results. It is vital that Carla has proper nutrition and therapy to aid in her growth development and prevent undernourishment. 6 months from today, we hope to see improvement.
Our second SMART goal has to do with her physical strength. So Carla will improve her physical strength in her arms and legs. Specifically, a physical therapist and her primary care physician will work with Carla to achieve this specific goal. Carla's strength in her arms and legs will be addressed separately. She will improve her fine motor strength by increasing her weight bearing over this time and improve her leg strength by practicing her walking and balance without a stander. Carla has limited mobility and physical activity. She struggles to hold heavy objects and spends several hours a day in a stander. With these beginning points, Carla should be able to grow her strength gradually over time. Although she may lack the same physical development as other 8-year-olds, she is still capable of growing these muscles to improve her strength. Carla's physical strength is prominent in her daily life. It affects her mobility, walking, activities, and fine motor skills. These all play a role in Carla's life constantly, and it is an important aspect of her health to be addressed. This goal will be worked on throughout her entire life. However, we would like to see significant improvement in Carla over the next 6 months.
Okay, so the first healthcare professional that's going to be working with Carla is me, the primary care physician. And a primary care physician has responsibilities that include things such as disease prevention, counseling, managing chronic diseases, physical examinations, and much more. The main concept of a primary care physician is to lead a patient to good health and also help with preventative care. If there is a problem with a patient that's out of the scope of him, they can easily transfer to a specialist in the needed field. For the responsibilities in Carla's case, the primary care physician is basically the middleman between all the other people that Carla's working with. I'm the first person she's going to meet with for both physical and cognitive problems, and if she's struggling with a certain aspect, I'll send her to a specialist. I'll deal with problems like blood work, seizure medication, monitor her ankle incisions from surgery, and more. I will also watch her calcium and potassium levels since they are low, and make sure she's no longer in a caloric deficit so she doesn't lose any more weight. Checking on her joints after using her stander for long periods of time is also important. Being the middleman, it is essential to stay in contact with all the other healthcare professionals. In this case, it's a registered nurse, physical therapist, dietitian, and a speech language pathologist. If Carla is having problems in a certain field, I'll be sure to send her over to the specialist so she can get the help she needs. Contacting these specialists beforehand is important so that they know the patient and her problems before she even comes in. And for the SMART goal, Carla needs to improve not only physically but cognitively as well. We'll obtain this through different types of training through a timely format. Carla and I will be meeting bi-weekly in order to go over things such as evaluating physical health, her motor functions, and diet. The meetings with Carla will be the way to obtain the goal because I will be able to see if she's making progress or not. If something is not progressing, like her speech, then Carla will be sent to a specialist. Physical and cognitive skills are essential and important to life, which is why it is so important for Carla to stay motivated and stick with the goal set for her. And although this goal is long-term based, we hope to achieve the goal set for Carla in 6 months' time.
So the physical therapist scope of practice is the physical therapists evaluate and record the progress of a patient throughout treatment. They aid in improving movement or relieving pain from injured or ill patients. Physical therapists play an important role in rehabilitation, preventative care, or treatments for patients with chronic conditions. Physical therapists consult with patients regarding their physical conditions and symptoms. They can develop a treatment plan based on diagnosed movement dysfunctions. Physical therapists teach patients proper exercises and therapeutic techniques, and also provide stimulation and massages to promote healing. The physical therapist's responsibilities. Since Carla is not physically active and has limited mobility, a physical therapist could help her with her motor functions. Her inability to hold heavy objects can be worked on with a physical therapist who can provide exercises to gradually increase her strength and fine motor skills. Since Carla spends several hours a day in a stander, a physical therapist could help her balance and strength of muscles to help her stand on her own. Regarding her Achilles surgery, the physical therapist will help rehabilitate Carla from this procedure as well. Carla's physical therapist will need to work collaboratively with her primary care physician and the registered nurse. This will help monitor her general health in response to the increase in activities, as well as observe her throughout the school day to record any improvements in her strength. The physical therapist SMART goal. A physical therapist is going to help Carla work on her fine motor skills and strength, as well as her ability to stand on her own. The physical therapist will work to help Carla hold a weight for an extended period of time, as well as her ability to stand on her own for an extended period of time. Carla should be capable of reaching these goals with gradual increases in her motor strength and leg strength. Although her physical development is somewhat hindered, she is still able to grow her muscle to improve these functions. Carla's motor skills and her ability to stand on her own play a role in her daily life. Many activities will be easier for Carla with the physical improvement of her arms and legs. A 6-month time frame has been set to achieve these goals for Carla. It will take some time to see improvement since her development is delayed. However, this time frame will be reasonable to see changes.
Dietitian scope of practice. A registered dietitian scope of practice consists of an integration of research, education, credentialing, and practice. Registered dietitians work in both clinical and non-clinical settings. Dietitians have a main focus to provide nutrition and food-related services to the public and communities to enhance their health and well-being. They also aid in the healing process and/or maintenance for patients by providing personalized nutritional plans and information. Dietitian responsibilities. In this case with Carla, a dietitian is more than necessary to see due to the risk of malnourishment and growth delay in cerebral palsy patients. My role is to assess her in every visit and make sure she meets her individualized dietary needs for her condition. Carla has been found to be underdeveloped and deficient in protein and vitamins. As a dietitian, I provide her mother with a meal plan or options to incorporate and how to make it an easier feeding. I will list semi-solid fluids that aid in her growth development, high in protein and vitamins. To provide optimal care and prevention for Carla, it is necessary to collaborate with other healthcare providers such as the general physician to facilitate optimal care for the patient. In this case, I may need to consistently keep record of Carla's visits with me, health status, or any concerns to communicate to the physician. It will also be recommended to collaborate with the speech-language pathologist. Since Carla's swallowing is affected, it is important for the dietitian to be updated with their development to avoid destruction of their digestive process. SMART goal for Carla: increase Carla's potassium and calcium levels, plus her protein intake by her next physician examination visit in 2 weeks. Carla will incorporate the foods recommended into every meal, at least 1 to 2 recommended items in each meal. She will also include some sort of protein in meals. Her levels can easily raise within 2 weeks with the consistency in diet and supplementation as directed. I will make sure her mother knows how to prepare certain foods and provide a grocery list to make it easier to follow. Carla's developmental growth relies very much on her diet. A proper diet should always be followed throughout her life to prevent any more deficiencies and underdevelopment. This goal should be achieved by the next physician exam in 2 weeks. Meal plan ideas: eggs for protein and muscle growth, mood regulation, and memory. Nuts such as walnuts and almonds, which are rich in healthy fats, and you may feed it in form of butter. When making food, use olive oil, which aids in brain development and healthy brain cells. Incorporate more leafy greens such as spinach and kale, which can also raise potassium levels and overall good health, and it's recommended in smoothies. Incorporate kefir or Greek yogurt, which is rich in calcium, probiotics for gut health, and contains some protein. Continue incorporating root vegetables, mashed. Eat anti-inflammatory foods to reduce aches and pains in Carla's body, such as ginger and turmeric, which can be in tea, and salmon. Salmon is high in protein, healthy fats, and is very anti-inflammatory. She can also eat legumes such as chickpeas, which can also be mashed. Supplement with vitamin D for musculoskeletal health, and potassium-rich foods such as bananas, spinach, potatoes, lentils. And a suggestion for breakfast is amaranth, which is rich in needed nutrients like calcium.
Speech language pathologist scope of practice. According to the American Speech Language Hearing Association, a speech language pathologist is a professional who engages in clinical services, prevention, advocacy, education, administration, and research in the areas of communication and swallowing across the lifespan from infancy through geriatrics. Scope of practice. Speech-language pathologists, or SLPs, work to prevent, diagnose, and treat speech, language, cognitive, and swallowing disorders in both children and adults. SPLs have the authority to do a multitude of procedures. Their scope of practice allows them to assess, diagnose, and treat language, speech, communication, and swallowing disorders. SPLs also provide educational training to family members, caregivers, and others. They specifically collaborate with professionals from other fields of work. Speech-language pathologists have a responsibility to their patients. They must collaborate with healthcare professionals and many other shared communities or services. It can include a wide range of professionals to accommodate the patient and their struggle with the disorder adequately. Some professionals can consist of physicians, nurses, physical and occupational therapists, dietitians, teachers, psychologists, social workers, and rehabilitation counselors. Speech pathologist responsibilities. Since Carla's communication level is below average for her age range, a speech pathologist is crucial to her overall health and quality of life. A speech-language pathologist's role in Carla's case would be to develop her communication ability, speech, and language. Carla's cognitive development, motor control, improve her ability to feed and swallow. Carla's speech pathologist must address her motor control since swallowing is an essential oral motor skill. To properly gain the right forms of nutrition, it is crucial that SPLs also collaborate with the patient's dietitian and primary care physician to address the issue. Exercises will be provided for the tongue and throat muscles, and sessions should be held to engage in activities specifically made to develop motor skills. To address the lack of communication and develop her speech and language skills, Carla's speech pathologist must focus on her minimal abilities to communicate. Carla can speak a few words and uses sounds to communicate. She attempts to gesture with her hands, but this is limited due to poor motor control. This will be approached through a series of activities during sessions and at-home practice. She responds to some simple questions like likes to bob in her wheelchair to the sound of music and can wave goodbye to her family. To develop her communication skills, the speech pathologist must pair up cognitive exercises for patient results. This can be addressed by interacting with Carla through her likes and dislikes. For example, family members and other professionals must consistently interact with Carla by engaging in activities. For instance, identifying shapes and colors, or listening and singing to Carla's favorite music. Speech therapist SMART goal. To first, improve motor control, swallowing, and speech within 6 months to 1 year. Second, performing exercises to strengthen the tongue and throat to improve the ability to swallow, improve speech skills by interacting with the child consistently, improve cognition by focusing on the alphabet, numbers, shapes, colors, identify noises, or listen and sing to Carla's favorite music. Improve motor function by engaging in activities such as puzzles and making sandcastles. Third, a proper form of exercise to the affective areas over a long period can surely assist Carla in the long run towards her growth. Carla must stay true to her therapeutic sessions because it can surely enhance her quality of life. If exercises are discontinued or not implemented in Carla's daily life, her overall health can deteriorate, leading to many more health issues. We aim for improvement within 6 months to 1 year.
Registered nurse scope of practice. The type of RN that Carla will interact with the most on a daily basis is a school nurse. According to the National Association of School Nurses, their scope of practice is defined as facilitating normal development and positive student response to intervention, providing leadership in promoting health and safety, including a healthy environment, providing quality health care and intervening with actual and potential health problems, utilizing clinical judgment in providing case management services, and collaborating with others to build student and family capacity for adaptation, self-management, self-advocacy, and learning. Registered nurse responsibilities. Carla's mom is an RN and takes care of her at home. During the school day, the school nurse will oversee her care. Because Carla is very developmentally behind her age group, she will be placed in a multiply disabled classroom. The school nurse is responsible for instructing the teachers on their responsibilities in emergency situations. The nurse should reach out to the primary care physician to get their recommendations for care. The school nurse is likely the only healthcare provider in the given school, district, or region, and they are responsible for all students. They should take extra steps in facilitating the proper care and safety of students with disabilities. One of the first responsibilities that a school nurse should have in caring for a patient like Carla is to create an individualized healthcare plan. This includes a seizure action plan, which delegates responsibilities to her teachers on what to do in the event of a seizure, such as timing and documentation. This is signed by the primary care physician, school nurse, and her mother. This individualized healthcare plan also includes plans for any teaching required for the teachers, such as what to do in the event of choking and going over basic skincare. Because Carla is wheelchair bound, she's at risk for pressure sores on her body. This plan should be created by the end of the first week of school. Registered nurse SMART goal. Go over the seizure action plan with Carla's teachers and delegate responsibilities. All teachers Carla interacts with should be involved and should be able to properly demonstrate the responsibility in a case of a seizure. Carla's paraprofessionals and specialized teachers have the qualifications necessary to perform the required actions in seizure safety. Creating this plan is relevant to Carla's well-being. She is at a seizure risk, and those around her should be knowledgeable about what to do in the event of a seizure. This plan should be done within the first week of Carla starting school. Group process. The individual responsibilities of each healthcare professional came together as we set patient care goals as a team. We saw how each role depended on one another to treat the patient as a whole. We prioritized Carla's health aspects that primarily affected her daily life. We all agreed that her diet and swallowing and physical strength would be the most prominent in her daily life and require the most collaborative process. It went smoothly working together with each healthcare professional, as all parties are essential for the treatment of our patient. Our team was overall very effective in working collaboratively, since every healthcare professional has an important role in Carla's health. We discussed collaboratively with Carla's primary care physician to elevate her general health. Each healthcare professional discussed their individual responsibilities, which allowed us to develop the overall plan of care for Carla based on her main health priorities.
IP teamwork. We learned with the importance of working interprofessionally and how all aspects of healthcare are truly related. While each healthcare professional has their independent responsibilities, they all contribute to a larger goal of the patient's overall health. There are many aspects to working collaboratively that are necessary to protect the patient. Records and documentation of every visit with every healthcare professional is absolutely necessary. Communication amongst professionals will improve her care and effectiveness of treatments as well. Ensuring that each healthcare professional's roles are clear so that no responsibilities are overlooked.